I work at the VA, and the VA largely serves an older population. The epidemiology of gout is such that it tends to come to people over the age of 55. And there's a rising epidemic of gout. So between the age and the rising in the numbers of gout patients, we see a great deal of gout in the VA. And a lot of it comes referred to us from the emergency room, for sure. For example, a patient will have their first flare of gout, and the pain will be so intense, it will come on so quickly and be so strong that often they just can't handle it with simple over-the-counter kinds of remedies, so they'll come on to the ER where their pain can be more adequately treated. What happens is if patients begin to come back to the ER for repeat flares of gout, then the folks down there realize that this is becoming a chronic problem. This is a problem that needs more than periodic emergency pain treatment, and they'll refer them to us to try to manage the gout more effectively. Referrals out of primary care or out of other specialties to rheumatology for the treatment of gout tends to happen when the gout has become not so simple to treat. When the medicines used to lower uric acid don't seem to be working as well or as fast, or they're not well tolerated, or the goal of getting the uric acid to 6 or less can't be achieved easily, or the pain control is not good, or they're having flares in spite of what they're using to treat. That's the point at which primary care will say, I just need somebody a little more dedicated to dealing with complex gout, and that's a good referral source. Another place might be other specialists like cardiology, for example, who might have a patient that they're seeing for heart disease but actively complaining about persistent gout flares. Well, that person may make the referral because that's not what their focus is. That's not what they're doing for that patient, and they want that patient seen by somebody who does a lot of that kind of work. If they're just beginning to have flares, maybe they've had one, maybe two, and they've largely had those treated in the emergency room, all they know is they have joint pain. They have a red-hot swollen joint, and they want that treated. So that's not exactly a teachable moment, but when that's a pattern, when that's recurring, then they want to know what's causing this, how can it be treated, and how can I make it not come back? Then people want to know about it. That's when the education has to happen about gout as a form of arthritis that can be deforming, that can be erosive, that can have a huge impact on function. It's very, very helpful for patients to have good, solid information about gout. Information that's scientifically valid, that's data-driven, that's based on evidence and not based on opinion or based on fad or based on commercialism. So a lot of patients will come in and feel that there's a sea of information that they want to help you sort through. Coming in a gout flare is not a teachable moment, but it's often such a vivid memory that when they do come in, they really want to figure out how they can do a lot of self-management, how they can understand their disease.